Then we go to so there is another part of the text. So we stopped with this, and if we move to the next slide, did we listen to Labib?
Yes, ma'am.
Okay, so Hepzibah, please.
Okay, ma'am. Effective ways of improving compliance rate involve the complementary use of educative, practical, and emotionally and behaviorally supportive interventions rather than the provision of information alone. There is evidence that regardless of the specific knowledge imparted, self-management programs which help to raise people's sense of efficiency, and confidence promote better medicine taking.
Yes, self-efficacy. So, and you see here is the ways how to improve compliance. Do you see? So just how to improve. So give knowledge to people, right? And what else should we do to improve concordance?
Giving support,
practically, emotionally,
and behavioral support for them.
So, and introduce some self-management, just programs here, right? And the next piece of information is for Sila. Read it, please.
Health professionals should respect patients' autonomy and accept that increasing compliance with prescribing instructions is not individual needs and priorities. And patient need help to make informed choices about treatment. For example, there is a need to differentiate between situations where verifying the timing or quantity of medicine doses may do harm or even be beneficial, and situations in which there is a high probability of adverse.
Okay, so the ideas in this paragraph are about just keeping to patients' individual needs and just about making informed choice by the patients and varying the quantity of medicine, doses and timing of taking medications. Okay, so now there is one more piece of information, and now this is for Asna. Asna, please. Asna?
Ma'am, can you hear me? Hello, ma'am.
Read it, please.
Ma'am, the improvements of in-safe management of skills and complements in medicine, taking can generate significant benefits for individuals and the population as whole, and the combining medication reduced with other forms of timely and release, the other form appropriate support for patients and the results and important towards a better and more cost-effective use of medicine.
Okay, so good. We were just listening to the sounds of the chorus. Just yes. Anyway, if we focus on this part of the article, so so this is about also how to improve self-management. Yes. Okay. Anyway, so we understand what is said in this paragraph, and now let us please focus on the questions. How well do I understand? We remember what was said in the article, and let us answer the questions. So the first question is for Shamisha. Read it, please. Shamisha,
Hello, ma'am.
number one.
What features of new medicines should make people take the medicine prescribed to them?
Mhm.
Fewer side effects and more convenient use.
Exactly. Yes, you're right. So, Ramisha.
Yes, ma'am. Which medicines are least likely to be taken by patients? Medicines prescribed for preventive purposes are especially then likely not to be taken as
Yes.
prescribed.
Good. Well, John Parvin.
Group is more likely not to take medicine prescribed because they do not believe in the illness is there.
Group of people.
Yes, ma'am. Dying of illness, especially the younger people.
Younger people, yes, because they do not believe the illness is there. Okay, Hala Malik, please.
Besides prevention, what effective ways can improve compliance? They can be improved by educating a practical and emotional behavior support to the patient. Support mainly interaction with the patient.
Good. Well, Sultan, the next question is for you.
Yes, ma'am. What is more important than increasing the compliance in patients, meeting patients' individual needs and priorities, and the use of educative and the practical, emotional, and behavior support for interventions.
You're right about individual meeting individual needs. Yes, that is. Okay, so the sixth question is for Sindhu.
What do patients need help to make? The patients need to be helped to make informed choices so that the medications and the timing of the medication doesn't vary so much and involve within their lifestyles, and also about as it can make a little harm or more harm, so it should be handled carefully, and the needs help in that.
Okay, thank you. And now please, Danish.
Seventh question.
Yes.
What can be of help to both the individual and the general population? It will be improvements in self-management skills and compliance in medicine taking can generate significant benefits for individuals and population.
Okay, good. So these are the ways out of just solving the problem with concordance, as you see. And so we continue speaking about side effects of some medications, and here there is a cartoon just illustrates the idea of side effects in a humorous way. Just the doctor is looking for side effects with AstraZeneca, and he says that he can see the side effects of this shortness of breath, chills, and sweating and trembling. But as it turned out that the nurse hasn't injected the patient yet. Okay, and yes. Let us focus on just some grammar when the doctors explain the side effects to patients. So to show that a drug or medicine causes side effects in some people, it is important to understand the difference between can and may. So both words are used to express possibility, and in most cases they are interchangeable. But there is a slight difference in the use of can and may, because can expresses a theoretical possibility and may expresses a real possibility. And there are two examples that illustrate this idea. If we use can, like in the example, in the sentence, that door can be locked. It means it's possible to lock that door. And right now it is either locked or unlocked. We can so just lock or unlock the door. And if we use may, that door may be locked. It is possible that the door is locked right now. And if it is locked, we won't be able to open it. So as you see, theoretical possibility and real possibility. Well, and on this slide, there is some information about the use of can. It is used to say that a side effect is possible. This medication can cause some stomach irritation. It is possible for this medication to cause some stomach irritation. Can indicates that stomach irritation is a possibility. To reassure patients, you can emphasize that the side effect is theoretically possible, but not of serious concern to the patient you're talking to. It means this occasionally causes stomach irritation in some people, occasionally in some people, this is the meaning. Or sometimes people get stomach irritation with this, but it isn't usually a problem. So this is the meaning of can. And a similar situation, but when we use may, it also expresses a side effect. That side effect is possible. And if you say this medication may cause some stomach irritation, it means that it is possible that this medication will cause some stomach irritation. In this case, may indicates the possibility of the statement being or becoming true. The word may in this sense is frequently stressed and indicates that stomach irritation is a strong possibility. This is the main difference, that can is just low possibility and may is a strong possibility. You may want to emphasize this. There is a strong possibility that this will upset your stomach. Do you understand the difference? Okay, and so this is a practical exercise for you. We need to use the words instead of the gaps in the sentences. We should complete the sentences with the words which are given in the box. Possibility, may, will, can, probably, or may not. And let us look at the first sentence. And Ashwati, will you read the first sentence, please?
In some people, it can cause a fleeting headache, but it doesn't mean you dash get on.
What do you suggest to use in this sentence?
You will.
Yes, it doesn't mean you will get. Will get one. Yes, right. Okay, so please also several minutes for you to just, let us say 3 minutes to complete all the sentences individually. Write them, please, and use the one of the words which are given here. Okay, start, please. Well, let us read the sentences. And now, Taib, the second sentence, please.
Yes, ma'am. Theoretically, this can cause low blood pressure, but you probably won't have a problem. Probably.
Probably, yeah. Do you all agree? No reply.
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, ma'am.
Okay. So please, Labib.
Yes, ma'am. Some people get blurred vision, but it may not happen in your case.
Yes, this is about side effects. Okay, good. Please, Hepzibah.
There's a strong possibility that this will upset your stomach. In fact, it may make you feel really ill.
Yes, good. You see, the phrase strong possibility in the first sentence goes together with the use of may in the second sentence, which means the same. Okay, the next is for Ansila.
Swelling of ankle is not common, but it is possible. It can happen.
Yes, it can happen, but it is not common. And Asna, please. Asna, are you here? No. Yes. Number 6, Asna.
This may make you dizzy, so you should be careful when you drive.
Yes, exactly. So it will happen. That is why we use may here. This is the main difference. So keep in mind this information, because there are some sentences with will and can in the test. So you should understand the difference in the use of these modal verbs. Okay, and so there is information about there is a writing task. I mean, so you know, when we were speaking about which group of drugs some medicines belong to. We were speaking about diazepam, and you remember that this is a group of sedative or hypnotic drugs. And I hope you know something about this medication. And I would like you to write some sentences about the benefits and side effects of diazepam. And so you should use the sentences which are given here. In some cases, the tablets can, some people, there are some people, or theoretically can cause, and so on. So please write several sentences, just how you are going to explain the benefits and side effects to your patient. When you speak about diazepam. So please. 5 minutes to you to write the sentences. Okay, so please. So let us check what we've written. Now, who would like to speak about this? Yes, Hepzibah?
Yes, ma'am. So in some cases, the tablets can increase the level of calming and the calming chemicals in the brain, and it can also cause, in some people, it can cause drowsiness, headache, dizziness, nausea and fatigue. And there are some people who, theoretically, this can cause mental or mood changes and slurred speech or trouble in walking. And the benefits of diazepam is, in some people it can use to treat anxiety, muscle spasm and fits, and also for alcohol withdrawal.
Okay, good. Does anyone want to add anything to this list? Yes, Hala Malik.
Ma'am, ideally 5 mg. Ideally 5 mg. The dose is used as 5 mg. Doctor put up ideally 5 mg as the dose.
Okay. Anything else?
It may even cause hallucination, ma'am.
Exactly.
Theoretically, it can also cause constipation, but it may not happen for every patient.
That is why you use can. It can cause, yeah?
Yes, ma'am.
Okay. Good. Okay, so I think we can just give the ladies a chance to show their presentation. And so Ansila, Ashwati, and Ramisha. So are you here, ladies?
Yes, ma'am.
So I'll just, you can share the screen with us. So I change something here. Yes. So you can start just your presentation and just speaking. Yes, we can see. Start, please.
Good morning, ma'am. We are here. There is Ashwati, Ramisha, and Ansela is here to talk about hemotherapy. So, when we talk about chemotherapy, it is a treatment of disease which is by the use of blood or blood products from blood donation. So it mainly consists of the removal of patient's own blood, which is subjected for the process of biooxygenation, and then it is processed to return it back to the body to increase its immune system as well as the vitality. And they also help in restructuring and also by regenerating the new body's cellular function. And also this therapy is used as a single preventive treatment for many diseases, and they are also
Hello. I can't hear you.
She lost her network connection.
Can the other student continue?
Yes, ma'am.
Yes, please.
can
When
you
we
hear
talk
me now?
Mm-hmm. Yes.
Okay, ma'am. So then it is also used for the treatment of viral infections like common cold and influenza. And also, this is used for certain skin conditions too. It is used for burning the heals or edema like that. And this it includes various types such as blood transfusion, the RBC blood cell transfusion, fresh frozen plasma transfusion, as well as the plasma phases of various kinds. In which blood transfusion, which is the process of transferring the blood products into one circulation, which is being injected intravenously. In case of packed red blood cells, it is also known as packed cells. Here, the red cells have been separated from this transfusion, and it is used for the anemic patients where there is hemoglobin content. And in freezer and free frozen plasma is a blood product which is made from liquid portions of our blood, and it is used to treat low blood clotting factors. And also the last one is the plasma.
Ma'am, actually,
Next we
she
need
have
to
some.
continue. That's the
Yes. Can I continue, ma'am?
Yes, continue, please.
Yes, ma'am. When we talk about the preparation, to prepare for a non-emergency blood transfusion or chemotherapy, we can maintain normal diet and activities before the procedure. And most non-emergency transfusion are done in an outpatient clinic, and we have to check with a doctor to see how much time to set aside for this procedure. And the procedure lasts at least an hour and can last up to 4 hours according to our disease. There are generally no special restriction on heating, though it does make sense to be well hydrated. There are also no restriction on activities before or during transfusion, as long as it doesn't interfere with our intravenous and if the line is already placed. After the first 15 minutes of chemotherapy, we can eat and drink or work on our phone or laptop, and bring a sweater or a favorite blanket in case you feel cold. It may be cause sometimes fever. And before going to complication, I want to talk about some information about preparation. During a blood transfusion, a healthcare professional will place a small needle into the vein, and usually in the arm or hand. The blood then moves from a bag through a rubber tube and into the person's vein through the needle. They will carefully monitor vital signs throughout the procedure. And I'd like to hand over to Ansila to talk about the complications of chemotherapy.
Chemotherapy is generally considered reliable, and most transfusions are done without any problem, and it is generally safe. And talking about the complication, the most common complication of transfusion are febrile, non-hemolytic, and chill trigger reactions. And this can cause acute hemolytic reaction due to ABO incompatible transfusion, and it has high mortality rates. And occasionally a patient who has been sensitized to RBC antigen after transfusion, there's a chance for causing delayed hemolytic transfusion reaction. And allergic reactions are common in some people. And these reactions are edema, occasional dizziness, and headache, and immediately after the transfusion. And for patients who have cardiac or renal insufficiency, there is a chance of volume overload, which may cause heart attack. And bacterial contamination of RBC occurs rarely. And we know that life cycle of malarial parasite happens in RBC. So if sometimes malaria can be transmitted easily through these infected RBC. And there are some people who shows complications of massive transfusion. That's from our part. Thank you, ma'am.
Okay, thank you, ladies. Do you have any questions to the speakers? I see. Okay. So good. And yes, you see, there is a test on Moodle site. So, and after this class, you should go to the Moodle site, and I'll open the access to your group just to start the test. And the test will be available for about an hour. And so there are 50 questions, and they give you maximum score of 59 points. This is the maximum points you can get for this test. And yes, and you'll see how long it is. As far as I remember, this is 1 hour. Yes, when it starts, it will close automatically in an hour. And so you should start exactly after the class, because the time, the access is limited. And there is also one task, like some grammar exercise, which you should do and upload to the Moodle site. The deadline is different this week. This is Friday, so by the end of Friday, because I need to just give you the score for this home assignment and calculate your final score for midterm 2. So that is all. Just I planned to tell you during this class. Do you have any questions? No questions. Okay. So now I'm going to Moodle site to give you access to the test, and you just follow me, and see you next week. Okay. Good luck to you. Have a good day. Goodbye.
Thank you.